The first-line randomized phase 3 studies in urothelial cancer that are integrating immune checkpoint blockade with chemotherapy all actually do involve a maintenance strategy with immune checkpoint blockade continued after the chemotherapy. It's a little bit of a different question because in that situation, the patients have already received immune checkpoint blockade up front, might be responding to that, might be responding to chemotherapy, might be responding to the combination. And so I think this study does help to contextualize what the maintenance portion might be adding to those regimens, but it's not exactly the same. It's not exactly an apples to apples comparison. With regards to combination switch maintenance approaches, I think that's something that people are starting to think about. I do think it's important to step back a little bit and think about what we're trying to achieve in this setting. And one of the potential benefits of immune checkpoint blockade as a switch maintenance strategy, as perhaps opposed to some of the other things that have been explored in this situation, which are non-cross-resistant chemotherapies, is that really you're hoping to allow patients to have their responses maintained or improved, but at the same time give them a break from the toxicities of chemotherapy. And the more we add in terms of side effect burden in that setting, I think we start to diminish a little bit what we're trying to achieve. So it'll be a balance.